1 in 5 women are diagnosed with ovarian cancer too late to receive any kind of treatment. 20% of patients find out they've got stage 4 cancer because their symptoms are overlooked or they don't get tested in time. In fact, ovarian cancer is the biggest gynecological killer of women in Britain, with the UK having some of the worst survival rates in Europe. Which is why it's so crucial that we all know the symptoms and we push for a diagnosis ASAP. If you get diagnosed in the earliest stage, you've got a 90% chance of surviving over 5 years. That drops dramatically to 40% by stage 2, which is halved again to stage later. By the final stage at which so many women are diagnosed, you've got a 95% chance of dying before those 5 years are up. Time is everything. March is Ovarian Cancer Awareness Month, and experts are hoping that over the next 4 weeks, more women will feel more confident about spotting signs. Katherine Taylor, Chief Executive of Ovarian Cancer, told Eve Appeal, ovarian cancer is not as well known as other female cancers, yet it is the 5th most common, with a woman dying every 2 hours. This shocking statistic could be reduced if cases were diagnosed earlier, and this will only happen if we can raise awareness. We want every woman to know the symptoms and to feel confident that they can speak to a well-informed doctor. So with that in mind, here are the 7 main signs you need to watch out for. 1. Bloating. Loads of us suffer from bloating on a regular basis, but here, we're talking about chronic bloating that doesn't go away after you've had a poo or a few hours after eating. 2. Pain in your belly or pelvic area. Again, belly aches aren't uncommon, but if you feel pain every day, then that's an indication that something's up. If you have tension in your stomach or pelvis which goes after passing wind or going to the loo, you might have something like IBS. With ovarian cancer, however, there's no physical release. 3. Feeling full quickly when eating. Changes in appetite are always worth getting checked out. If you normally demolish 3 good meals a day and suddenly find yourself struggling to eat half of your breakfast, something's not right. 4. Needing to pee more often. Drinking more water might make you run to the loo, but when you're peeing more frequently for no apparent reason, it's worth getting checked out. Needing to pee usually isn't a sign of ovarian cancer, but could be a symptom of something else going on in the area. 5. Back pain. Like needing to pee more, there are any number of reasons why you might get lower back pain. But if you have any of these other signs, then you absolutely must go to see your GP as soon as you can. 6. Change in poo habits. Our poo tells us a lot about our health. To know if anything changes, you have to be aware of what's natural for you. If you normally go for a poo once or twice a day and suddenly find yourself running to the loo 5 or 6 times, that's a sign that something is off. The same applies if you struggle to go at all. 7. Unexplained weight loss. If you haven't been actively trying to lose weight and find that a couple of stone have suddenly fallen off, that's not a good sign. Losing weight when you are not trying to is a very common symptom in people with cancer. It may be one of the reasons you first go to the doctor. An unexplained weight loss of 10 pounds or more may be the first sign of cancer. Cancer Research UK says if you are not dieting and you lose more than 5% of your normal weight in 1 month or 10% in 6 months, your doctor will want to find out the cause. For example, if you normally weigh 10 stone, 63.5 kilograms, and lose half a stone, 3 kilograms, in a month, or a stone, 6 kilograms, in 6 months, that would need investigating. This may not seem like a lot of weight, but if you continue to lose weight at this rate, it could become a serious problem. Many of the symptoms can be mistaken for IBS or PMS, which is why ovarian cancer is so hard to catch early on. The key is being able to recognize what's normal for you. As soon as you notice things changing, go to your GP. We pay for your stories. Do you have a story for the Sun online news team? Email us at tips@thesun.co.uk or call 0207 782 4368. You can WhatsApp us on 07810 791 502. We pay for videos too. Click here to upload yours.